know what Planned Parenthood is. And Planned Parenthood is a nonprofit organization that provides sexual health care in the United States and globally. And they're the nation's largest provider of sex education as well. Since President Trump took office, women's rights has been assaulted, especially by the administration's effort to defund Planned Parenthood. My proposition is that defunding Planned Parenthood would cause a negative effect in many lives in the United States. Sorry. My first claim is defunding Planned Parenthood would reduce access to all the resources and services that they provide. My second claim is that defunding Planned Parenthood would reduce access to health care. And my last claim is that it will cut out many educational programs to many individuals. So, Planned Parenthood offers many more resources and services, more than abortions that everyone may know, but they offer like HIV testing, cancer screening, birth control condoms, tampons, pads, and any kind of like general health care. From their site, it states that 2.4 million people would lose access to all those resources and services that they provide. Without that federal funding, many women without services to avoid pregnancy will result in thousands of additional births. An article from Forbes stated that with the resources Planned Parenthood provided, they saved thousands of women's lives each year just from cancer screening. Services like cancer screening saved nearly 88,000 lives in the year 2012 to 2013. Without that federal funding, many women's lives would be endangered due to that service being gone. And from NBC News, we learned that when Texas removed Planned Parenthood from their clinic, their state pregnancy rate that was covered by Medi-Cal increased up to 27% in 2011. My second claim is that defunding Planned Parenthood would reduce access to health care. And for many individuals from low-income communities, Planned Parenthood is their primary source of health care and provider for health care need. According to an article from Family USA, a report shows that all the women who go to Planned Parenthood, 4 out of 10 of them say that that's their only source of health care. And from our Congressional Budget Office, it estimated that if we were to defund Planned Parenthood, 360,000 people would lose complete access to all the care the Congress would block from Medi-Cal patients that were accessed from Planned Parenthood. And if they don't get that care from Planned Parenthood, they're really not going to get any care at all, because they provide a lot more than like what your other health care does. And my last claim is that if we were to defund Planned Parenthood, many educational programs would be cut off to many individuals. And it's crucial to teach students and teenagers all the dangers, the positive and negative aspects of sexual education, because it's crucial to learn that you should know how your body is developed and how not to get any STDs or like unwanted pregnancies. An article on revealing numbers from CNN stated that Planned Parenthood reaches out to 1.5 individuals each year, and 64% of those are middle school and high school students. So if we were to like block out all the federal funding, they will have nowhere to turn, and that would leave them completely helpless. I mean, we took classes in middle school about sex education, but it wasn't probably like as effective, you know? And we feel more comfortable asking questions in those clinics because it's on one-on-one, and you get more reliable, more like closure to what you have to ask. And in conclusion, if we were to defund Planned Parenthood, it would cause a negative effect in many lives in the United States by causing them to lose all the access to resources and services that they provide. And the healthcare access would be completely lost to some individuals, and educational programs would have to be cut off. Emily. Sorry. Is that for you?
That's fine. I pay attention.
I'll give it to you after. Okay,
Cool, yeah, makes sense.
All right, well, the subject area is clear. You clearly state the proposition. That part's good. There's a pretty solid preview of the supporting points, although some of the supporting points sound very repetitive. And so I think that, you reduce access, and we cut access. I think you need to kind of focus on the things that we lose rather than repeating the reduction claim. So if we're going to reduce access, but you're going to say we're going to reduce access to women's health care, we're going to reduce access to screening services, we're going to reduce access to educational programs. That, I think, needs to be cited a little bit more clearly. The first 2 points sounded like they were exactly the same, and I think there is a difference between them, but it didn't come across very clearly, especially at the beginning of the speech. In the body of the speech, I think you're generally following the structure that you set up at the beginning, but I did miss the transitions a couple of times between the points. I could tell where you were headed most of the time because I'm listening to the evidence, but you want to make sure that the audience is listening to you on all of those supporting points. So maybe the numerical signpost is a good idea to do on those individual points in the body of the speech as well. There's generic information about Planned Parenthood and all the medical benefits that they provide. I thought that was a little thin. You do make reference to some cancer screening, 88,000 lives being saved. It wasn't clear if that 88,000 lives is being saved because of the cancer screening done by Planned Parenthood, or if cancer screening saves 88,000 lives a year and Planned Parenthood does some of that cancer screening. So that, I think, is a little unclear as to where you're headed. I was also a little confused about the resource. I could be wrong. I thought Medi-Cal was a California thing, and what Texas is doing with Medi-Cal is unclear to me. It may be just a name that is, maybe there's a different name for it. Medicaid is what you're referring to. It's not quite clear. And if you're quoting sources directly, you're going to run into that problem less. If it is a direct quote, then you need to maybe explain a little bit more about how Medi-Cal works. The source citations, I thought you did a pretty good job on. You cited Planned Parenthood itself and Forbes, and you've got NBC and Family USA and CNN and the CBO. So you're pretty consistent about citing those sources. Some of them, I think, could probably be a little bit more authoritative. They're general information sources. The CBO, I think, is probably the one that works the best for you. At the end of the speech, I thought there was a very effective summary of your argument. It could be a little bit smoother when you're presenting it. I got the feeling that you were rushing at the end, and as a consequence, that's a little bit problematic. Anxiety issues sometimes crop up a little bit, but for the most part, you did a solid job speaking to the audience and presenting the claim that you were making. All right, thank you.